Bismillahirrahmanirrahim. Quote of the day is planning is the sunnah of Messenger of Allah sallallahu alaihi wasallam. He meticulously planned everything and he relied on Allah subhanahu wa ta'ala for guidance and accomplishment of his goals. My name is Dr. Aamna Khalid. I am PGR of Community Medicine in Institute of Public Health Lahore. I will be presenting the topic of health planning under the kind supervision of Professor Dr. Saida Afzal, who is Dean Institute of Public Health. Learning objectives of today's presentation will be, we will describe different types of plans, we will explain goal setting approaches, we will state purposes of planning, we will identify 5 elements of a plan, differentiate planning approaches, describe health planning cycle, community health planning models, and then we will do the practice of MCQs. So planning is a process of deciding in advance what to do, how to do, when to do, and who will do it. It involves setting the objectives, determining the strategies, and selecting the best course of action. Why planning is important in health sectors? Because the health resources are limited, they are expensive, unequally distributed, and we have to use the resources efficiently. Therefore, planning will help in preventing the duplication of different interventions. It will improve the coverage and improve the quality of care. For example, if we go without planning, then the vaccines we have may expire. But if we have a proper plan, we will properly cover the vaccination campaigns and the coverage will improve. There are different types of plans, and we can classify the plans based on different things like the breadth, time frame, specificity, and the frequency of use. First of all, we will see the classification based on the breadth of the duration. The first of all is classified as strategic plans. These are long range plans. These plans are made by the top management and it majorly focus on the overall goals. For example, the National Health Policy, National TB Control Program, these are the long range plans. Then the second one is operational plan. This is a short range plan which is made by the middle or low managers and it mainly focuses on the implementation of that plan. For example, the monthly immunization micro plan at BHU. Then we classify plan as a long-term plan and short-term plan based on the time frame. Long-term plan is having the duration of more than 3 years and it has broad objectives. For example, eradication of polio. It will take a long time. Then the second category is short-term plan, which ranges from for less than 1 year, and these are the immediate activities. For example, monthly dengue surveillance. This is the short-term plan. Now we classify the plans according to their specificity. Either it's directional or specific. Directional plans have flexible guidelines. They are used when uncertainty exists. For example, for the COVID-19 preparedness, the plans were directional because we were not sure about all of the things about COVID-19. Then the second thing is a specific plan, where we have clearly defined objectives and there is no ambiguity. For example, we have to vaccinate 95% of the children under 1 year by December. Then on the basis of the frequency of use, we have single use plan or the standing plan. Single use plan is only a one-time plan. It's used for a unique situation. For example, if there is some flood and we go for a flood relief health camp, this is a single use plan. Then we have standing plan, which is used repeatedly for policies, rules, procedures. For example, hospital infection control policy. This is going all the time. Then the next thing we will cover is goal setting in planning. Goals are the desired outcomes the organization wants to achieve, and goal setting can be done either by the traditional goal setting or the management by objectives. Traditional goal setting, goals are set at the top level and they are passed downward in the hierarchy. But the problem with this approach is that goals, while moving downward in the hierarchy, lose their clarity Managers add their personal bias, and workers have low ownership. While in the second category, we have management by objectives where goals are mutually agreed. Employees also participate in the goal setting and their performance is measured against the set objectives. Advantages of this approach is that motivation of the employees increases, their accountability increases, and there is a better teamwork. Then these are the five elements of planning. First of all, the important thing as a part of planning is objectives, means what we want to achieve. And the objective must be smart. Smart means it must be specific, measurable, achievable, relevant, and time bound. For example, we set an objective to reduce maternal mortality by 20% in the next 3 years. Then the next thing is policies. These are the general guidelines for decision making that we have to provide direction to the staff, and not it's not very detailed. For example, free vaccination for all of the children under 5. Then the third thing is program, which is a set of related activities to achieve those objectives. These are the organized set of health services. For example, the EPI program. Then on fourth number, we have schedules. These are the time plan of activities. Uh, this specifies when activities will occur. For example, on Monday, there will be antenatal care clinics. On Wednesdays, there will be vaccination clinics. Then fifth important thing is the budget. This is the financial plan for the program. This is the allocation of money and resources. For example, the salaries of the staff, medicines, transport, and equipment. Planning approaches are three. The first one is comprehensive rationalism, then mixed scanning, and the third one is incrementalism. Incrementalism is the small changes from existing plan. For example, we just increase the OPD timing by 1 hour instead of making a new hospital. In comprehensive rationalism, this is the ideal scientific method, and we collect all the data, analyze all the alternatives, and then choose the best option. For example, but the problem with this approach is this is time consuming and expensive. The best method and the most practical method is mixed scanning, which is the combination of rationalism and incrementalism. Now we come to the health planning cycle. And that, how we have to do the health planning. First of all, we will go for the assessment of the health situation, analysis of the health data, which is the community diagnosis or the situational analysis that is based on the existing health facilities, how they are used, that is based on the political, social, and cultural context of the people they are living in, and their health and demographic data. From this analysis, we prioritize the health problems, which are the fact needs of the people. Then we establish the goals and the objectives. We assess the resources and we design a time frame. Then we will go for the execution of the plan we have made. After the execution, we will continuously do the monitoring and then evaluation at the end, either the goals are achieved or not. If the goals are achieved, then we will continue the execution, monitoring, and evaluation of that plan or program or planning. And if the goals are not achieved from our evaluation data, then we will again assess the health situation, and the cycle goes on. This is again almost a repetition. These are the stages of national health planning set by World Health Organization. First of all is situation assessment and priority setting, identifying the effective strategies, costing scenarios, resource planning and budgeting, programming and implementation, monitoring and evaluation. Okay, the situational analysis, which is community diagnosis, this includes the study of health status of the community, including the population size and structure, morbidity and mortality data, environmental conditions, health services available, political, social, and cultural context. And we do the situation analysis by using different methods like surveys, health records, census data, interviews. The purpose of situational analysis is to identify the major health problems of the community. Then we do the health needs assessment. And there are different types of needs. First one is felt need, what people think they need. The second thing is expressed need, which is the demand for the services, which services they are using mostly, and what is the demand of the services. Third one is normative need, that the experts have done some analysis and they have defined that these are the needs of the people. The fourth thing is comparative need, which is compared with other populations, that what's the value in different populations within our country or the neighboring ones. And the purpose of a health needs assessment is to identify gaps between the existing and the required health services. Then we have to establish the objectives and goals. After the problem identification, we decide what we want to achieve. And again, the objectives should be smart. We have gone through it in the previous slide. For example, we increase the immunization coverage from 60 to 90% within 1 year. Then we assess for the resources. The purpose of assessment of resources is to know whether the objectives are realistic, and we identify the available resources by seeing the manpower, material, money, and method. In manpower, we see doctors, nurses, LHWs, vaccinators, lady health workers, and vaccinators, how many of them are available. In the material, we do the assessment of medicines, vaccines, equipment. For money, we do the budget allocation. For methods, we see the technology, transport, and infrastructure already available and needed. Then we have to fix the priorities, which is very important because all the problems cannot be solved at once. We have to choose the most important one needed at this time. So the priority depends on the magnitude of the problem, severity, preventability of that problem, available resources, and the community concern for that problem. For example, immunization is prioritized over minor ailments. One of the methods used for priority setting is Hanman method, in which priority score is based on the size of the problem, like the magnitude of the problem, seriousness of it, effectiveness of the intervention done for the problem, and feasibility. And this is used to rank the health problems objectively. This is a research paper where they have used the Hanman method. They have identified different problems and they have found the score of each problem. For example, they identified that there is low social interaction, lack of regular physical activity, inadequate eating habits, non-adherence to medicine regime, occurrence of the falls, and the fear of the falling. These were the different problems, and they scored each of them according to the four things: size, seriousness, effectiveness, and feasibility. And they found the total score, and then they found which problem should be prioritized first. Then we have to formulate the plan properly, and we have to document it, and then we will go for the implementation. Prepare the written plan document, which will include the objectives, target population, activities, time schedule, budget, responsible persons who will be doing all of the things. This provides guidance for implementation. Action includes we have to convert the plan into action. We will organize the staff, train the workers, procure the supplies, and we will conduct the field activities. For example, we start with the vaccination sessions in outreach areas. Then further on, we will do the monitoring. This is the continuous supervision during the implementation, and it will answer, is the program being carried out as planned? This will include the regular checking of the records, field visits, progress reports. This will help detect the problems early. Then at the end, we will do the evaluation. This is the assessment after implementation, and it will answer, did the program achieve its objectives? There are different types of the evaluation. For example, we do the evaluation that immunization coverage increased to 88%. Okay. Now we will go through the different health planning models. The major community health planning models are precede and proceed model, map model, match model, patch model. These four are the important ones, and we will go through the detail of these programs. Otherwise, we also have the Apex PH and the PACE EH and CHIP model. Okay, first of all, we will see the detail of precede and proceed model. Starting from the phase one, we have to do the social assessment, then casual assessment, then phase three is the behavioral and environmental assessment. In fourth phase, we do the educational and organizational assessment. Fifth phase is administrative assessment. Here we diagnose what the problem is, and then in the next phase is, and these five phases are included in the precede model. Then we go to the proceed phase where we have to do the implementation, and we will do the assessment, including the process evaluation, impact evaluation, and the outcome evaluation. I have given the examples of each of the phase in this slide. In the proceed phase, first of all, we have to do the social assessment, which is to identify community perceived problems, how community perceive their problems. For example, mothers report that their children are weak and they are not active. Second step is epidemiological assessment, where we identify the magnitude of the disease. We identified that 45% of the children reported by their mothers were underweight on their growth charts. The third stage is behavioral and environmental assessment, where we identify the behaviors and conditions causing the problem. So we saw that poor breastfeeding and unsafe water were the reasons. Next stage is educational and ecological assessment, where we identify predisposing, enabling, and reinforcing factors. We found that mothers lack nutrition knowledge and there is no access to the diverse food. Then the next stage was administrative and policy, where we identify resources and barriers, and we found that no lady health worker nutrition sessions were available. And then we come to the proceed phase. Now we decided an implementation plan and we started the intervention. We started to conduct the mother nutrition education sessions. In the next stage, process evaluation, we saw that was the program delivered properly. So we counted the number of sessions being held. In the next stage, impact evaluation, we see did the behavior of the students change, of the children change, and we saw the exclusive breastfeeding increased or not. In the last stage, we will do the outcome evaluation that did the health status improved. So we saw the weight again and underweight prevalence was dropped. This was just an example scenario. The next model is patch model, which is the planned approach to community health. The focus of this model is to identify the community health priorities. So it starts from the community mobilization, then we do the data collection, priority setting, intervention planning, and the evaluation. Again, I have given the examples for each of the stage, and the examples used in this model is dengue control in an urban area. So the community mobilization means we have to engage the public. We will do the, for example, we will do the community meetings. In the second stage is data collection. We gather the evidence. For example, uh, 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 we see that high dengue incidences reported. A third stage is priority setting. We choose the main problem. For example, mosquito breeding sites. Fourth one is intervention planning. We plan for the action. For example, we source the reduction campaigns. A fifth one is evaluation, where we measure what was the outcome of our plan. So we saw that fewer dengue cases were seen in the next season. The third one is match model. This is multi-level approach to community health. The focus of this model is in designing the structured health education programs, starting from the goal selection, intervention planning, program development, implementation, and evaluation are done in this model. Again, I have applied some examples. The example used here is school hand washing promotion. The first step was goal setting, where we choose some objectives. And in this example, we see we have set the goal to reduce diarrheal disease in school. Then we do the intervention planning, means we choose the strategy. And in this example, we did the planning that we will teach proper hand washing to the students. Third stage is program development. We prepared all the material, for example, the posters and demonstrations. Fourth one is implementation. We have to deliver the program in this stage. For example, we do the school health sessions. Fifth stage is evaluation. We check for the results, and we saw that after all of these health sessions, is there any reduced absenteeism due to diarrhea? Okay, fourth one is MAP model, which is mobilizing for action through planning and partnerships. Uh, Here we have both the community and local organization who jointly solve a health problem. So we organize for a success and a partnership is developed. Then comes the visioning, means we have to set some goal. There are four map assessments given in the outer circle. We have first of all we will do that assessment. Then we will identify the strategic issues. We will formulate the goals and strategies. Then we will go for the action. We will implement that strategy we have chosen, and we will evaluate it. The four assessments, map assessments, are given in the outer circle, including the local public health system assessment, community health status assessment, forces of change assessment, and community themes and strength assessment. Again, and this model, for this model, I have also used an example. Example here is improving the maternal health services in a town. The first step was we have to organize the partnership, means we have to involve the different stakeholders. And here we, in the example, you can see that doctors, nurses, and different community leaders were involved. The second step is visioning, means we have to share the future goal, means safe pregnancy for every mother. A third stage is assessment. We have to collect the local data. For example, high home delivery rate was found. Then a fourth one is identify the priorities. We have to select the major issue. For example, we found that lack of antenatal care is there, so this was our major issue there in the example. The fifth stage is action and the plan. We have to decide the activities. For example, we decided that we will do the antenatal care clinics and awareness sessions, and then we did the implementation and put the plan into action. Weekly maternal clinic were started. So these were the four major models for health planning. This is the summary of these models, that which model focus on what major point, and what is the best use, when to use which model. So first of all, we have pre-seed and post-seed model, which majorly focus on the detailed assessment of behavioral, environmental, and policy factors. And its best use is in the national or large-scale public health programs. Second one was patch model, where the focus is on the community involvement and participation. For example, it can be used for the district or community health planning. The third one is match. This is the behavior change and health education program design. For example, it is used for the health promotion and education interventions. The fourth one was MAP, which focused majorly on the community-wide strategic planning with the multi-sector partnerships. For example, it's used for the local public health system planning. Okay, now we come to the practice of MCQs. The first question is, a district health manager plans a polio eradication strategy expected to run for more than 5 years. This is an example of option A, short-term plan, option B, standing plan, option C, long-term plan, option D, operational plan, and option E, incremental plan. Okay, this is the long-term plan, because it is yes, because it's for more than 5 years. Long-term plan ranges for more than 3 years. Question number two is, a district health office writes a plan stating that we have to vaccinate 95% of the children under 1 year by December. This is an example of option A, directional plan, option B, strategic plan, option C, specific plan, option D, standing plan, and option E, operational plan.
C.
Yes, C is the right answer. This is a specific plan. Question number three is, in a district hospital, staff and management jointly decide targets and evaluate performance based on the agreed objectives. This approach is known as option A, incrementalism, option B, mixed scanning, option C, management by objectives, option D, traditional planning, and option E, comprehensive rationalism.
C.
Yes, option C is the right answer, management by objectives. Question number four, a public health officer proposes increasing the OPD hours by 1 hour instead of building a new hospital, making small adjustments to the existing system. This planning approach is option A, mixed scanning, option B, comprehensive rationalism, option C, strategic planning, option D, incrementalism, and option E, operational planning.
D.
Yes, D is the right answer. We have just adjusted the existing system. Question number 5 is a district health team studies population structure, morbidity data, environmental conditions, and available health services before designing a health program. This stage of planning is option A, priority setting, option B, situational analysis, option C, monitoring, D, implementation, E, evaluation.
Situational analysis.
Yes, option B is the right answer. Question number 6 is in a village survey, mothers say they believe their children need nutrition supplements, although they have not demanded services yet. This type of need is option A, normative need, B, comparative need, C, expressed need, D, felt need, and E, absolute need.
Felt need.
Yes, felt need. Option D is the right answer. Question number 7. A health officer prioritizes diseases using criteria such as size of problem, seriousness, effectiveness of intervention, and feasibility. Which priority setting method he is used? Option A, Delphi technique. B, nominal group technique. C, Hannon method. D, SMART method. E, MBO method. Option C, Hannon method is the right choice. All of the 4 steps are included in the Hannon method for prioritization. Question number 8. During a vaccination program, supervisors regularly check records, conduct field visits, and review progress reports. This activity is called option A, evaluation, B, monitoring, C, impact assessment, D, situational analysis, E, priority setting.
A.
Option B is the right answer, monitoring, because they are regularly checking the records. Question number 9. A district health office organizes community meetings, collects dengue data, selects mosquito breeding as a priority problem, and plans a source reduction campaign. Which planning model is being used? Option A, match, B, precede and proceed model, C, patch, D, map, and E, apex pH.
B.
Option C is the right answer. Patch model involves the community at the start. Question number 10 is a public health team first studies community perceptions about children being weak and inactive before identifying the disease burden of malnutrition. Which phase of the proceed model does this represent? Option A, epidemiological assessment, B, social assessment, C, educational assessment, D, administrative assessment, and E, impact evaluation.
Social.
Beta. Beta.
Yes, beta is the right answer. This is a social assessment that what people think their problem is. This is the answer key to all of the questions. This is the YouTube channel of Institute of Public Health Lahore, where this presentation will be uploaded later on. Thank you.